Hi there, my name is Melanie Glowa, and today I will be walking you through my PowerPoint on multiple sclerosis. All right. So I wanted to include a little bit of photos to kind of show you the demyelinization. So multiple sclerosis is an unpredictable autoimmune disease for this project of the central nervous system that disrupts the flow of information within the brain and between the brain and the body. It's a neurodegenerative disease and it affects the myelination. And so here in these two pictures, you can see the change between the myelin sheath and the damaged or demyelinized sheath. And that's where the disease is kind of eaten away. So there's 4 different types that have been identified. And then this disease affects your quality of life more so than the duration of your life. But it has been noted that on average, multiple sclerosis can take off around 7 years of the life from those it affects. And it's found to be progressive and debilitating. So who gets multiple sclerosis? So it's kind of random. It has been linked to environmental and genetic causes, but it cannot be completely pinpointed or predicted. So most people are diagnosed between 20 and 50, and women are 2 to 3 times more likely to get this than men. And research has seen that ethnic groups, including Black people, Asians, and Hispanics, and Latinx, have been found to have it, but it's more common amongst white people of European descent. And it affects around 2.5 million people worldwide, and they estimate that about 1 million of that is in the United States. And something I found interesting was that it's more prevalent in colder climates and urban areas. Now, I'm not sure if that's based off of like whole number population or percentage. So I couldn't find information on that. The etiology, so that's the cause of the disease. It's currently unknown. Like I said, genetic and environmental factors like the cold and the urban have been linked to susceptibility. Evidence suggests that it is caused by a dysregulation of the immune system. And then, so what happens is the lymphocytes cross the blood-brain barrier to the CNS, causing the inflammation. Inflammation leads to infection. Infection leads to demyelinization, gliotic scarring, and axonal loss. Can't speak today. Keep looking at myself. Okay, so here are some general symptoms. These can be the primary symptoms or the secondary symptoms. The primary symptoms are going to be what the patient is initially feeling, and the secondaries are going to be symptoms that happen because of the initial symptoms. So like the sensory loss puts you at a risk for falls and stuff like that. So early on in MS, it usually starts with vague symptoms that disappear completely within a few days or weeks, and then they'll suddenly appear and fade back and forth. So here's a couple symptoms. And then some of the later symptoms include secondary symptoms that often worsen and decrease the quality of life. So prone to falls, decreased bone density leading to increased risk for breaks, osteoporosis. These are the things that tend to shorten the patient's life. So here again are the primary and the secondary, cleaned up into nice little columns. So some of the primary symptoms that are most prevalent are numbness and weakness, visual problems, slurred speech, fatigue, dizziness, tingling. And then the secondary is going to be some of the things that arise because of those primary symptoms. So the bladder dysfunction that happens is going to cause repeat urinary tract infections, and so on and so on. While these symptoms can be treated, the optimal goal is to avoid them by treating the primary symptoms. Here is the pathological process. So infection, inflammation, the immune system attacks the myelin sheath, causing that infection, inflammation, injury. Then you have the destruction of the myelin, so the demyelination, and that the demyelinization, so that eating away that you saw in the first slide, is what leads to the sclerosis, which is the scarring. And you see a lot of that. And then osteoporosis, erosion, comorbidities, secondary symptoms occur because of that. Here are some of the pathological interactions on a little bit more deeper level. So in the blue is going to be the symptoms that you're going to see, and then around them is going to be describing some of the pathology behind it. So the damaged nerve finder, cannot speak, nerve fibers in the spinal cord and the brain are what cause the painful muscle spasms. And then those painful muscle spasms happen, and then you have falls, and then you have, so the pain, the falls, the hopelessness, all of those real core nursing diagnoses that you focus on are kind of the end result of these pathological interactions. You see gait and mobility issues due to muscle weakness, due to the nerve fibers being damaged and the inability, so the loss of muscle strength, mobility, neural transmission. So you've got delayed neural transmission. That's going to lead to some of the sensory issues that you find, like the tactile or the kinesthetic or the visual disturbances that you see with patients. So the flashing lights, the floaters, stuff like that. Another one, so the neuromuscular impairment leads to discomfort and pain, which is going to lead to impaired physical mobility. That impaired physical mobility can lead to bed sores, puts your patient at risk for bed sores, blood clots due to immobility. Some really important things to focus on. Some of the diagnostic tools used, so cerebrospinal fluid analysis. You're going to have that, MRIs, and evoked potentials. So with the CSF, you're going to find an elevated protein level. WBC level is going to be higher. Electrophoresis of the CSF shows increased myelin, basic protein, and IgG bands. So that immune reaction and infection. The MRI is going to show lesions in the white matter in those ventricles of the brain. Let's see. And something that I found interesting was that accidental findings of these lesions are becoming more common and are the initial indicators of multiple sclerosis, and people are able to start treating those symptoms faster. Evoked potentials, so that's where different sets of nerves are stimulated and then electrically measured. And then so it shows pretty much like the speed at which electrical conduction happens. Some of the treatments, pharmacological and non-pharmacological. So on the pharmacological, you'll have the corticosteroids that helps the anti-inflammatory, so decreasing that inflammation. That'll help decrease the pain. That'll help slow down the demyelinization. Immunosuppressants decrease that immune reaction, so the body, the cell's not necessarily attacking itself as much, slows down the progression. Immunomodulatory, I've said that word 10 times, immunomodulatory drugs, which is the most common one I think I've seen is methotrexate, help decrease the symptoms and induce remissions in combo therapy. So using that in conjunction with different medications. And then anti-anxiety medications, treating some of the initial symptoms like pain relief, anxiety, bowel issues, bladder issues, stool softeners, stuff like that. Now, some non-pharmacological methods I saw, one that I thought was very interesting is dietary changes, because it shows that vitamin D concentration is lower during MS relapses. So increasing intake of vitamin D could help slow down relapsing. Lifestyle changes, yoga, stress relief, really treating those primary and secondary symptoms to increase the quality of life. Mild strength training. So a lot of the non-pharmacological methods are going to be about the quality of life and not necessarily the disease itself, and battling those physical limitations. Keep looking at myself when you look at the camera. And here are my references. I do want to point out that I used the Multiple Sclerosis Society webpage, and I found a ton of really interesting information. And I found it was also a very thorough resource for anyone that wanted to know a little bit more about multiple sclerosis. And it was very nicely organized. So that was probably my favorite reference that I had used, because it was just chock full of information and resources, and also a sense of community for anyone that's battling multiple sclerosis. So thank you for listening.